perspective of the family caregiver in view of the benefits of the permanence of the person with advanced chronic illness at home. We know that in the current demographic and socioeconomic context, the increase in average life expectancy and prevalence of people with progressive and disabling chronic diseases reflects a greater need and complexity of care, implying new ways of caring. On the other hand, the family plays a fundamental role in the care process as it assumes its continuity and the maintenance of its elements at home. The responsibility of providing care to the person with advanced chronic illness in the performance of their daily activities has been identified as one of the factors that can precipitate important emotional changes and influence the well-being of family caregivers. However, many studies show that families prefer to take care of their family members at home, and they in turn prefer to be cared for by their family members, even facing illness and even death process, regardless of their personal, family, cultural, and socioeconomic differences. Taking care of a family member at home according to the wishes of both allows them to live in their family environments with more individualized, personalized care, with greater convenience and proximity to those who are most dear to them. In this context, knowing and understanding the emotional dimension of family members is essential for the development of intervention and support strategies contributing to the prevention of the development of pathological responses. Few studies address the emotional experience of family caregivers when a person with advanced chronic disease is discharged home. So, the objective of this study is to analyze the perspective of the family caregiver in view of the benefits of staying with a person with advanced chronic illness at home. According to the problem and the objective of the study, this investigation is assumed as a qualitative study, a case study. The inclusion criteria were defined as being a family member of the person with advanced chronic disease, being 18 years of age or older, accepting to belong to the study, and assuming the responsibility of caring for the patient at home after discharge from the surgery services. This study had the participation of 10 family caregivers of the person with advanced chronic disease, hospitalized in the surgery service, and discharged home. For data collection, a questionnaire was applied in order to obtain a brief socio-demographic characterization of family caregivers and the person cared for, followed by a semi-structured interview. The profile of the family caregivers show that the majority are female, married, aged between 37 and 70 years, and cohabits with a sick person. 70% are daughters and 30% wives. Most of the family caregivers in this study do not work, and about a third remain employed. The profile of the person with advanced chronic disease shows that the majority are female, aged between 70 and 88 years old, and there is a greater expression of oncological diseases, and all patients have some degree of dependence on self-care according to the Bartel Index. After analyzing the narratives, the results of the study reveal that from the perspective of family caregivers, the permanence of the person with advanced chronic disease at home has benefits such as love, comfort, and accompanied end-of-life process. Being able to provide love is mentioned as something very rewarding, as it can create emotional bonds, smoothing the negative effects of the care process. The family caregivers of the study consider that at home, there is a greater availability to time to provide care, attention, and allows maintaining the emotional bond between the family and the patient, in which the provision of care is involved in actions and gestures of respect and solidarity. Homes Home seems to be the place where there is the greatest opportunity to pamper, give affection, and provide love. For the family caregiver, comfort is a fundamental value to preserve the person's dignity. That is, for him, it makes a difference and maintains the person's identity as a dignified social being. On the other hand, it allows the provisions of care in the patient's space according to their preferences and routines. Caregivers revealed that they prepared themselves for the return of their family member through changes and adaptations in home structures and the acquisition of support equipment adapted to the home and to the patient's needs in order to provide comfort. Providing an accompanied end life process is one of the benefits reported by the family. A clear feeling of protection and belonging can be seen in the reports of family caregivers combined with the affective bonds of the family, which leads them to consider that providing an accompanied end-of-life process is also considered a fundamental premise for the patients and family. They value the fact that their sick family members can stay with the family, reinforcing the importance of mutual presence until the end of life. According to other studies, in advanced stage of the disease, family caregivers perceive that love, affection, attention, comfort, well-being, availability, and companionship are fundamental aspects of care process. Is a way of expressing confidence, compassion, gratitude, and protection. At home, allows the continuation of a relationship of affections. So we can conclude that family caregivers recognize that the permanence of the person with advanced chronic disease at home provides greater monitoring, comfort, affection, and consequently the well-being and quality of life of the person being cared for. It also provides family members with intimate moments and shared feelings and emotions. They recognize that upon discharge from the hospital to home, the nurse must ensure that basic needs will be met, and it is their responsibility to support in an integrated manner, offer guidance, provide information for care, and provide health care to family caregivers, detecting their needs, their difficulties, their problems, and desires. Assuming the family caregiver as a subject of nursing care and not just a partner, enhances health gains both for the patients and for the caregivers. Knowing the perspective of the family caregiver regarding the benefits of being able to care at home is essential for health professionals to contribute to a greater effectiveness of the care to be provided, and as such, more effective and efficient care. Taking these assumptions into account, the implication of this research for clinical practice are based on the following aspects. It's important the existence of social and emotional support networks that guarantee the quality of life for family caregivers, create space for critical and reflective discussion within the health team in order to develop specific skills in the context of communication information in order to enable the family caregiver to provide care and for their emotional self-management. Investing in more research in nursing that gives voice to other family members. The existence of elements of the nursing team specializing in community nursing will be preponderant for the dynamization of the implementation of interventions that promote the minimization of suffering of people with advanced chronic disease and family caregivers. It's pertinent to extend this study to other care contexts. Thank you very much for your attention.
Thank you very much for your presentation. It was very interesting and it was very kind of you to share with your results with us. Thank you.
Thank you.